My name is Ruth Ann Allison, and this is the final project for Nursing 414. Hi, Micah. This is my patient, Micah. Micah, how are you today?
Good.
My name is Ruth Ann, and I'm going to be your registered nurse. If it's okay with you, I would like to assess your cardiovascular system and your respiratory system. Will that be okay?
Yes.
All right. Well, Micah, here is a gown. I'm going to go out of the room. I'm going to go wash my hands. If you will put this gown on, and I'll be back in just a minute. Will that be okay?
Yes, ma'am.
Thank you. Micah. Yeah, just have a seat. What we're going to do is we're going to start off with vital signs. I'm going to check your blood pressure, your temperature, and your heart rate. And I'm going to get in my equipment. Okay. We will start off. We will do your temperature. We're just going to stick this under your tongue.
Okay.
Okay. There we go. If you'll just hold it for me, thank you. Okay. And when it beeps, we'll look at, okay, it's 98.6. So, Micah, that's normal. Next, I'm going to look at Micah's respiration status. And what I'm doing is I'm just going to count his respirations, and it is a complete cycle of the chest rising and falling. If his respirations are regular, we can count for 30 seconds. If they're irregular, you would want to count for the full minute. Go ahead, Micah, and I'm going to count your respirations. Okay, respirations are 18, and his respirations are even and unlabored. Micah does not appear to be in any distress. Micah, what I'm going to do next is I am going to palpate your heart rate. And I am just going to go to the radial side. I'm just going to go up your thumb and place my fingers right here. And if the heart rate is regular, I will count for 30 seconds, and if it's irregular, you'll count for the full minute. Okay, Micah's heart rate is 80 beats per minute. The rhythm is regular, and it's 2+. Okay. So, Micah, what I'm going to do next is I am going to check your blood pressure. I'm just going to raise this up. And you want to put your blood pressure cuff that covers, the correct size is when it covers 2/3 of the upper arm. And you want to place it at least an inch or so above the brachial artery. So we're going to do this. And Micah, what I'm going to do is I am just going to palpate. I'm going to pump the cuff up, and I'm going to place my hands on your brachial artery. Let me find it. And I'm going to start pumping this up, and when it stops, when I can't feel your brachial anymore, I'm going to go 20 over, okay? All right. So I am I'm going to put my stethoscope so I know where I need to go. I need to pump it up to 150. Okay. Micah's blood pressure is 132/72, and that is normal. Micah, what I would like to do next is I'm going to start assessing your respiratory system. And if it's okay, we are just going to kind of uncover you. Will that be okay?
Yes.
All right. Now, I've looked at his respirations, and they are even and unlabored. So now what I'm going to do is just inspect his anterior chest. I can do like that. Is that okay with you, just to be like that? All right. Okay, sit up straight for me. All right, so what I'm going to do is I'm just looking at his chest. I'm looking to see if there's any lesions, any scars. I'm looking for any abnormalities. And Micah, I do not see any. I'm also looking at the shape and the symmetry of his chest. Raise your arms up a little bit. His AP to lateral ratio is 1 to 2, approximately 1 to 2. His costal angle is less than 90 degrees. Mike, if it's okay, I just would like to palpate. I've looked over it, and if I can just, I'm going to place my hands over your chest, and what I'm going to do is I'm feeling for any tenderness or maybe any masses. So at any time during this, if it's uncomfortable, please let me know, okay? All right. Do you feel any tenderness?
No.
Okay, all right. Next, I want to palpate your trachea. I'm just going to check the trachea's position. I'm just going to place my hand right around your neck right here. The trachea is midline. Now, Micah, what I would like to do is I'm going to check for tactile fremitus. I'm just going to place my hand on you, and when I do, I need you to say in a deep voice, say 99. I'm just feeling the vibrations.
99, 99, 99, 99, 99, 99, 99, 99.
Oh, sorry, one more time.
99.
Thank you. Okay, and the vibrations do feel equal bilaterally, and if you were to have an increase in the tactile fremitus, that may indicate, it indicates a consolidated lung. If the tactile fremitus was decreased, that's more indication of a pleural effusion or a pneumothorax, and Micah's is normal. Micah, next what I would like to do is I'm going to percuss. I'm just going to place my hand over the, I'm going to find your second intercostal space, and I'm going to tap. I'm going to place my hand like this, and I'm going to use my other hand, my middle finger, to tap at my DIG joint. And I'm going from side to side comparing. Okay, and around about the second intercostal space on the left, I hear resonance. On the about the third to the fifth intercostal space on the left over the heart, it's a slight dullness. About the fifth intercostal space over the right is dullness, and that is where your liver is. So that was all normal. So next what I'm going to do is I would like to listen to your lung sounds, okay?
Yes, sir.
All right. And I'm going to start off with the bronchial lung sounds. The bronchial lung sounds are located right here. They're best heard over the anterior part of the trachea. They are usually a loud, high-pitched sound, and they have a short inspiratory phase and a long expiratory phase. And then I'm going to move down to the bronchiovascular. This is this area. They're best heard over around about the first or second intercostal space. They are medium sounding, they're moderate sounding, medium pitch, and they also have an equal inspiratory and expiratory phase. Then I would move on down to the vascular lung sounds. These lung sounds are heard most over the lung fields. They have a long inspiratory and a short inspiratory phase. So I'm going to go ahead and start off with the bronchial. And I'm going to listen with the diaphragm of my stethoscope. Take a deep breath for me. Okay. Okay, to the bronchiovascular. And you want to listen to a complete respiratory cycle. I'm sorry, I moved my stethoscope. One more time for me, Micah. Listen over here to the lateral part of his chest. Okay. Micah's lung sounds are cleared auscultation. I do not hear any rhonchi or any wheezing, no adventitious sounds. If I was to hear any adventitious sounds, you would want your patient to cough and re-auscultate. Micah, now what I need you to do is I need you to sit up for me. I need to see if your chest wall is moving symmetrically. What I'm going to do is I'm just going to place my hands on your chest, and I'm going to place my hands vertically over the costal margins. This is the apex. And I am going to need you to take a deep breath in and out. And I'm just watching my thumbs at the costal angle. Okay, great. And his chest wall is moving symmetrically. Next, I'm going to do it down here at the base. Okay. Okay. And my hands are moving symmetrically. All right, Micah. You doing okay?
Yes,
all right. What I'm going to need for you to do now, Micah, is I'm going to need to turn you around. I am going to look over the back part of your back. All right. Are you comfortable, Micah?
Yes, ma'am.
Okay. Also here, I'm going to inspect. I am looking for any lesions, any abnormalities. I'm also looking at his spine. Sit up straight for me, babe. I am looking at his spine, and I do not see any deformities. It does not have any lateral curvatures. All right, so Micah, I am also, again, I'm going to palpate your back. I'm checking for any tenderness or any chest wall masses, okay?
Okay.
You just tell me if you feel any pain. I'm just using light palpation for this. Okay, is that okay, Micah?
Yes, ma'am.
All right, so I did not note any chest wall, any masses, and he did not complain of any tenderness. Now, Micah, also I'm going to check for tactile firmness again. And when I place my hand on you, if you will just say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and they are equal bilaterally, so I do not note any problems. Micah, now I'm going to do like I did on the front part of your chest. I am going to percuss the back, okay?
Okay.
All right. Okay. And you don't want to percuss over the scapula because that is where you're going to hear a dullness. Palpating over bones. And I do hear resonance over about T10 to T12. Micah, also now I would like to check for chest wall expansion. So I'm going to place my hands like I did on the front. And I'm going to need you to take a deep breath in. And then, there we go. All right, we're going to do the base. And you're going about the 10th rib. Okay. Go ahead, Mike, and take a deep breath. Okay, and my hands did move symmetrically, so there's no problems there. Micah, what I'm going to do now is I am just going to listen to your lung sounds. And once again, the bronchial lung sounds, they're found in the nape of the neck. And then I'm going to move down to the bronchiovascular. These are located in between the scapula. And then we're going to do the vascular lung sounds, which are over here. And you use the diaphragm of your stethoscope. Go ahead and take a deep breath. And once again, you're going to listen to the complete respiratory cycle. Okay. And I do not hear any adventitious sounds. His lung sounds are clear to auscultation. All right, Micah, if you want to turn around for me, we're going to start on assessing the cardiovascular system now. All right? So what I'm going to do first, here you go, sweetheart. There. What I'm going to do now is I am going to just look at your carotid arteries. I do see that there is a slight pulsation right there, so that appears to be normal. Okay, I'm going to inspect his precordium. But first of all, Micah, I'm going to need you to lay down. I'm going to put you at about 30-degree angle. We're going to look over your precordium. There you go.
Thank you.
All right, and I don't see any lifts or heaves. Okay. I do see that there is a pulsation around at the apex, so that's normal. Now what I'm going to do, Micah, is I would just like to palpate your carotid artery. And this, you want to palpate one at a time. Okay. Okay, and Micah's carotid artery, the rhythm is regular, the amplitude is 2+, the contour is smooth, and the carotid is soft. Next, what I'm going to do is I'm just going to look at the jugular field. I am going to occlude right around the neck. When I do this, his carotid should flatten. So, Micah, I'm just going to do that real quick. Oh no, my pen light would stop working. Okay. Okay, and his jugular does flatten. Then you want to occlude right above the clavicle bone. I'm going to do that. And it does distend. So that looks pretty normal, Micah. Okay. Micah, I want to next start with palpation. I am going to palpate over your cardiac border. Is that okay? Alright, first what we're going to do is we're going to find the apex of the heart. You're going to go to the substernal notch, and you're just going to go down midline to the left. I'm going to see if I can palpate that. There we go. Alright. Okay, next we are going to start with the aortic. You just go back up to the suprasternal notch, and you go down to the second intercostal space to the right, and you just move over, and that is your aortic area, and I'm just palpating there. Then I'm going to move straight over to the pulmonic. Okay, we're going to go down 1 to Erb's point to the third intercostal space. Okay, then the fourth intercostal space, right there. And that is the tricuspid region of his heart. And then we're going to go over to the fifth intercostal space, mid-clavicular line, and that is the mitral area of the heart. Okay. All right. Micah, next I would just like to, I'm going to go ahead and listen to you, okay? This time I'm going to use the bell of my stethoscope. So you want to make sure your diaphragm, and then you just turn your stethoscope, and I am going to start off at the aortic area, okay? Herb's point, mitral, apex. Okay. Now, Micah, next I'm going to swap it back over and use my diaphragm. Okay. I'm going to start off with the aortic. Pulmonic. And the aortic and the pulmonic, S2 is greater than S1. And Erb's point, S1 and S2 are equal. And the apex of the heart, S1 is greater than S2. And Micah, that's all normal. All right. Micah, if I could go ahead and get you to sit up for me for just a minute. I want to, if you'll just turn back around over here. What I'm going to do now, Micah, is I am going to listen for any carotid bruits, okay? And you will listen with your bell of your stethoscope. And Micah, when I do this, I'm going to need you to take a deep breath and hold it, okay? Take a deep breath. Okay. No bruits noted. Now, I've already palpated his carotid arteries. I am going to palpate his brachial. If you'll just put your arm down, please. Okay, and this is on the medial side of the arm in the antecubital space. And these are 2+ and regular. Now, I'm going to go down to the radial. I'm just going to go up from the thumb to the radial side of the arm, on both arms. Rhythm is regular, and amplitude is 2+. Okay. Also, okay, sit up for me. Also, I am going to assess his femoral artery, and what you would do is, if laying back, you would place your fingers halfway in between the symphysis pubis and the anterior superior iliac crest. And so you would just palpate that. Also there, I would listen for any femoral bruits. And so anyway, next what I'm going to do is I'm just going to inspect the peripheral vascular system. Like I'm just looking at your legs. And I'm feeling the temperature. They are warm to touch. I don't see any lesions, varicosities, or leg ulcers. Next, Micah, I am just going to be looking at the hair distribution on your legs, and it looks normal. It's even. I don't see any hair loss. Another thing that I need to go back and do is I need to check capillary refill on his hands. And this is, the capillary refill is brisk, and it's less than 3 seconds. Also, I'm looking at his nail beds, the color, and they're pink. And I'm also looking at the thickness, and his nail beds are smooth and normal. I'm also going to do the same. Like, is it okay if I take your sock off?
Yes.
Okay. Also, I would do that on his feet. And I am looking at his toenails. And he does have good capillary refill, brisk, less than 3 seconds. And the thickness, there's, his nail beds are not thick. Okay, Mike, if you want to just kind of lay back up here, I am going to check your pulses behind your knee, your popliteal pulse. Okay. And you just want to go right up under. Okay. We're going to feel this one. Okay. And that's 2 plus and equal. Then I'm going to go down to the dorsalis pedis, and what I would like to do is just take my index finger in between his great toe and his index toe, and I'm going to go up till I find the pulse. And these are regular 2 plus. The next artery I would like to locate is the posterior tibialis, and what I'm going to do is just go to the inner part of his leg, and in between the malleus and the Achilles tendon, I am going to find that. And these are 2 plus and regular. I'm also looking for edema. Edema can be an indication of heart failure. And Micah's legs, there's no edema noted. Another thing, Micah, what I would like to do is I want to check Homan sign. And I'm just going to support your leg. And what I want you to do is dorsiflex your foot back. And let me know if you feel any pain. Do you feel any pain with that?
No.
Okay, Homan sign can be used if a DVT was suspected, but it doesn't always necessarily mean when you do have a DVT that you would have a positive Homan sign. Okay, and that wraps it up. Thank you, Micah, so much.